We are live now. We can start.
Okay. Good evening and welcome to you all, everyone present here. So I'm your host, Pankaj, bringing to you another webinar session on advances in medical science to fight HIV as with NHRA. So before I begin, here's a brief discussion about NHRA to our new audiences who are with us in this beautiful evening today. So, Enajori means born of unconditional love, and it is the born of unconditional love for his native land that brought back Milin Datta, the founder of Enajori, from the USA to start a non-profit organization in 2018, which engaged and promotes various initiatives and that are striving for social change in the Northeast India, including Assam. Okay, so today we have our special guest, Dr. Amit Harshana sir. So, and Dr. Amit Harshana sir, who is the technical director at UW International Training and Education Center for Health Limited, India. He is the medical doctor specialist in community medical, tropical medicine, London, and a Commonwealth sector. He has extensive experiences of providing support to various national and international platforms on HIV, TB, malnutrition, and in the capacity of medical lead and public health researcher. His major researcher. And yeah, his major areas of interest include clinical training, research program, implementation, and, and management, among others. So now I request Dr. Amit Harshana sir to deliver your kind word.
Great. Thanks a lot, Anna Jury, and thanks a lot, Kangan, for providing the platform. And thank you for the kind introduction. But I would like to say, at the outset that not exactly teaching. Actually, what I love is discussing things. And whenever we get a platform where we can share our thoughts and we can discuss our important whatever technical things that you guys think is important for you. So I thought this is a good opportunity, and also because the university students and all the audiences, it's important because no disease we can achieve let's say eradication or elimination unless until the general public is well aware about why it is happening and what we can do to control it. And that's the whole speciality that I'm having. I'm actually a community medicine specialist, which talks about how a doctor can deal with the whole community and how we can treat or let's say control the diseases. So overall, health for all, and we need to kind of go for that. So I guess today's topic, what the organization asked to me was about HIV and AIDS. And I'm not pretty sure about the audience. I'm sure that it is a mixed audience, but majorly not a medical background people. So I would try to keep it as simple as possible when we go through the topic. So let me know, Kangan, if that is what I understood correctly, and I can start, and I'll share some of the slides while discussing some of the points.
Yeah. Sure.
So if you can see the screen, just let me know and then I can start. You can see the screen? People can see the screen?
No.
Yes, sir, we can see.
No, sir.
Yeah, it's visible.
Okay. So, so I'm assuming we have somewhere around, I'll keep it like some 30-40 minutes to talk about the topic, and then whenever, if anybody, if you're getting a live question or something, you can stop me, and or maybe in the end we can take the session as you guys want. So getting into the topic, which is, we are talking about the HIV or AIDS. Because I can't see people here. I mean, I would love to see people when I'm talking about a particular session. So now, in this particular session, we'll be talking about what is HIV/AIDS, what are the typical modes of transmission, how and what we can do to, reduce the progression of the disease, how we can kind of reduce the chances of transmission, and what are the newer advances that we have in the country. And all what I'm saying at this moment is as per the technical guidelines, or let's say as per the guidelines which are there in the country, in the system. So I'm going to talk more about what is present in the system. I'm not going to talk more about, let's say, like, what are the global recommendations or what are the things which are not available. So I'll be sticking more to what is available and, what's there in the public health program. So when we talk about HIV, what is HIV? HIV is human. One second. So when we say HIV, just to kind of make it easy for all of us to understand, there are three components. One is human, and the other is I stands for immunodeficiency, V stands for virus. So I am sure we all are humans, so we know what is H. Immunodeficiency, in simpler terms, we all know, sometimes you get the viral fever, or sometimes you get any other infection. So what usually we tell to our, let's say, kids also, your immunity is going to get weakened. And if your immunity is not good, you're going to get some infections, or let's say some diseases or illness. So immunodeficiency is what it stands for I. And virus is, you all must be hearing about, especially after what happened with us with COVID. So I'm sure all of us, or mostly, most of us now know what is a virus. So virus, in simpler terms, is a pathogen, or let's say it's something which is foreign, getting inside your body and replicating inside some of the cells, and ultimately giving you some of the illness. So HIV is human immunodeficiency virus. So a virus which is actually causing some immunodeficiency. Now, so, again, a very simple structure of this virus. So this is how this virus looks like. I'm not going to go into the details, but I'm again sure all of you must have seen the virus of COVID-19. It also looks like almost similar. So it has got protein, it has got some inside materials. So, it gets inside the body, inside the cell, and then it starts replicating. And that's how you get all the diseases. So once the viral particle, or let's say what you're seeing inside, so this is a virus particle somewhere inside, where I have written RNA. So these are the strands. So this is genetic material of the virus. So the virus gets inside the body and it starts replicating. It starts replicating so fast, then ultimately the whole system would get engrossed with the viral particles. Now, what is important? Why I'm talking about this is because it is important even for a layman to understand this. And this is what probably in the end, or somewhere in the middle, I'll be talking about why this is important for us to remember. So just remember this, that the virus would be replicating, and there is something called viral load when we check it, for a person who is having the HIV infection, and we want to see whether the treatment is working or not. So just to keep in mind. Now, how HIV can be transmitted. So I am sure all of you must have heard about few things here and there. But, some of the pictorial things, self-explanatory, if you see here, so unprotected anal sex is what is going to give you, the virus. So suppose the person who is harboring the virus, or somebody who's infected, and if you are having even vaginal or anal sex with the person who's not having the infection, so I'm sure the person who's having the infection would transmit the virus to the person who is not infected. Now, also at the same time, from mother to child, this is also very important. And I'm sure I saw some of the questions which Kangan had shared. So a lot of people had questions somewhere around pregnancy and how we can protect pregnant women, and how we can reduce the transmission from pregnant women to infants, or let's say newborns. So the mother to child during pregnancy, childbirth, and breastfeeding. So this is also one of a risk area. And there are certain things that we can do to reduce it, and we'll be talking about that in coming slides. Then sharing of needles and syringes, I'm sure you would understand by this. So, if unprotected or let's say contaminated needles or syringes are shared, the person who is sharing it, suppose the person having the infection, so definitely the other person can get it if you're sharing the contaminated needles who's coming from the infected source. Transfusion of unsafe blood. So that's why it is a routine for all the blood products, or let's when it is transfused, we always do the screening. We want to make sure that the blood is not having, or the product is not having HIV infection or hepatitis infection, just to make sure that the person who is receiving it do not get the infection. And then the needle stick injury. Needle stick injury is mainly to the occupational exposure, so it relates to the medical profile. So, doctors or nurses or somebody who is dealing with patients, those who are infected, and then you get the injury while doing some procedure. So that is also one of the route by which you can get the infection. Now, I'm not getting into the details of this, just for the sake of understanding. So what in the starting I talked about viral particles. So the virus would get inside the body. Let's say here, what you're seeing at number 1 is, this is a virus. It gets inside the body, and there is a cell or immune cell which we know as CD4. So CD4 and viral particle. These are the two things which one has to remember. So even if you're not a doctor or a medical profile, you should remember CD4 and your viral particle. So by the CD4 cells, so ultimately to make it easy for people to understand, so there are immune cells in the body, meaning, so these are your protectors, or let's say warriors inside the body. So uh, these uh, these immune cells are trying to kind of provide you protection from all kind of foreign substances, be it bacteria, be it viral, be it fungus, or anything for that matter. Now, what happens is these CD4 cells are mainly the target of the HIV virus. So when HIV virus is targeting these CD4 cells, the moment CD4 cells the numbers start reducing, because the immunity is going down, and that's how ultimately people, or let's say the person who is infected, start getting the issues. So what are those issues? We'll be talking about in coming slides. So what is important for us to remember? There is immunity inside and provided by CD4 cells, and then there is virus. So these are the two important things for all of us to remember, because whenever you see somebody who is having infection, you look at these two things, and you would try to kind of make some inference, if not the complete kind of understanding of the medical thing. So, so we talked about HIV, right? So, what is AIDS? So, HIV. When I say, to repeat it again, human immunodeficiency virus. So, we saw that it's a virus. It's getting inside the body, attacking on your immune system, and once the immune system is weakened, the person who's harboring the virus start having issues. But also at the same time, it takes some time for the immune system to get completely, let's say, malfunction. So when this fight is going on, and then there is a time when the CD4 cells ultimately reduces or go down to that level, then ultimately the person start having issues, major issues. So that is why it is very important for all of us to remember that we have to identify the disease quite early, so that we can protect our CD4 cells. And how do we do that? We are going to see that in subsequent slides. So when we say AIDS, AIDS is acquired. Acquired is anything which is coming new. Immune ID is for immune deficiency. We talked about it. Syndrome. Syndrome is anything which is a group of signs and symptoms. So fever, weakness, or sweating, or diarrhea, or anything for that matter. So a group of signs and symptoms together, we call that as syndrome. So AIDS is acquired immune deficiency syndrome. So in order to understand the difference between HIV and AIDS, so HIV is where, so HIV is a virus. It gets inside the body. If you do not do anything, if you do not treat it, ultimately over the period of time, the immune system would be so badly affected, then you start getting something which we call it opportunistic infections. Meaning, some of the infections which if my body is immune, or let's say I have good or a strong immune system, I won't be getting those infections. But because my immune system is down, I start getting those infections, and those are the infections which ultimately give you all the problem which you see in a patient who is infected with the virus. So opportunistic infections are those. Now, just to repeat again, HIV versus AIDS. So HIV is a virus that causes AIDS. I hope we are following that. And not everyone who is infected with HIV has AIDS. That is because what I was talking about, if the immune system is good, if you're taking the drugs regularly, if you are going to your medical professionals regularly, if you're following what is being told to you, then hopefully you will not go into the later stages of the disease, which is bad and which is called as bad in the terms of not bad in terms of the disease is bad, the bad in terms of that you get all the infections which are tough to treat, and you can completely kind of avoid that. So that's important to remember. And everyone with AIDS is infected with HIV, because AIDS is the outproduct of what happened. Once you're infected, then you get AIDS. And AIDS is the result of progression of HIV infection, as we talked about. And anyone infected with HIV, although healthy, can still transmit the virus to another person. So anybody who is infected, can transmit the infection. That's very important. Even if, and that's why, when we say take all the precautions, take condoms, do not practice the unprotected sexual intercourse. All this is because you never know the person who's harboring the virus. So because once the virus gets inside the body, it takes a very long time for a person to get actually the typical symptoms. And before that, you can actually transmit the disease. So it is important for us to remember that we have to follow and we have to apply all the precautions, even if you're not tested positive for the HIV virus. Now, when I talked about disease progression, what I was talking about is now, if you remember these two things, in the starting, I talked about viral load and CD4 counts. CD4 count is your immune system. Viral load is when when the virus is inside the body, it is replicating, so it is growing in number. So these are the two things which are going to decide what is going to happen, with the person. So when viral load is high and the CD4 count is low, your protection is low, your virus amount in the body is quite high. So ultimately, you're going to have a lot of issues. And think about the vice versa situation, wherein you have pretty good CD4 counts. So as normal CD4 counts, and your viral load is almost nil. When that happens, that is when you can live a very healthy, normal life, even if you're infected. So what is important is here to remember that when you're treating somebody with something called as antiretroviral therapy, which we would talk about in coming slides. So when somebody is on ART, somebody is taking medicine. So for example, if you got fever, you take paracetamol. Somebody who's got pneumonia, let's say, you take some antibiotics. There is a course for it, like you take for 3 days, 4 days, 5 days, and then you become normal. The difference between any of the disease versus HIV is that once you are having the infection and you are started on ART, which is antiretroviral therapy or HIV medicines, you have to take them for lifelong period. There is nothing like you can stop it. There is nothing like you can cure it as of now. So once you started on treatment, you have to take it for lifetime. And the treatment nowadays is very simple, and we'll be talking about that also in coming slides. But what is important for all of us to remember that if you're infected, you have to take the medicines lifelong without kind of missing the drugs in between. Because if you're doing this, if you're following the medical advice, that what we know is that ultimately your viral load in the body, which is amount of virus in the body, would almost go undetectable. So when it goes undetectable, the chances of the person for having any other infections, or the person is going to have a very healthy life. But what happens is, when somebody is not having obvious viral load in the blood test, and you're having a healthy life, we try to become complacent, and what we do is we stop taking the medicines regularly, and we start missing the doses, and that is when the problem starts. So HIV is a very smart virus. It sleeps inside the body somewhere hidden, or it can go anywhere. So there are two things. One, the hidden virus will come again when you stop taking the medicine. So that will, you'll again get back the disease, and nothing can cure it. So that is what the science as of now is. And the second thing is, if you keep on missing medicines, the biggest problem what happens with the people is that the virus is smart in a way that, because there is not much of medicine coming to the body, the virus would start getting resistance to that particular medicine. So you can imagine, once you're infected, you have to take the drug for the lifetime. But also at the same time, because now you're having the resistant viral strain, it becomes very difficult for us to treat it. So what is the inference, or what is the take home message from this? That take the medicine as advised by the medical doctor, and please follow the whatever the doctor says. And if you do that, if the viral load is undetectable and your CD4 counts are good, you can live an as normal healthy life. So that is what is important for us to remember. Now this is all what I was talking about. I'm sorry this looks like a little complicated, but I will try to explain it in a very simple way. I hope I can do the justice to this. So you're seeing two lines here. One is the orange line, the other one is a blue line. So 0 down there on the left side, extreme down, what you're seeing is, suppose somebody who got infected. So what happens is, you got infected, you're having HIV virus in the body, the virus will start multiplying. So what you're seeing is the orange bar going up and up and up. And the body is fighting here because you have the immune cells. So body is fighting, and there comes a stage. So this is all when you're not taking the medicines. And there comes a stage where ultimately the body gives up, and the CD4 cells, or let's say the immune cells, would start going, the number would start going down. And then when the CD4 cell start going down, what happens is the virus or the viral load, again, because there is no immune cells in the body, the virus, would start replicating, like, enormous amounts of viral particles or the copies would be there in the body. So initially, here in the stage 1, what you're seeing, usually there is nothing, nothing would happen to the person, as normal as the person is, but the person can still infect, or let's say transmit the virus to other persons. Stage 2 is when you start getting some of the minor symptoms. You will get fever, some swellings here and there. So typically the person wouldn't even think about whether I'm having HIV or not. And then once the CD4 count reduces to that level, that ultimately the viral load, which is high, and CD4 count is down, it's when ultimately you get AIDS. And AIDS is, again, the syndrome which I talked about. So a lot of symptoms and a bad phase of HIV. So this is important for us to remember when we talk about the progression of the disease. So can the disease progression be delayed? So I would like to take a pause here, and I would like to ask if somebody can answer this. Can the disease progression be delayed? If anybody can talk about it. Do you think the disease progression can be delayed? Otherwise, this is going to be a boring topic, because I'm talking to my screen. So I would like, if somebody can stop me, or maybe just share your thoughts. Do you think the disease progression can be delayed? Because I've already given the answer. Do you think people can speak, or they're muted? Okay. I'm not getting the answer here, so not a problem. So what I can do is I will continue. So when I say the disease progression, whether it can be delayed or not, yes, it can be delayed, because what I said, if you take medicines and if you can prevent developing of all those infections by following the advice, so ultimately the disease progression can be delayed. Now, what is ART? ART is the treatment for HIV. ART is antiretroviral therapy. So no need to remember the name, but what is important is that it is the treatment for HIV. Somebody who's infected should be on this therapy. There is no effective cure for HIV as of now, but you can control it, meaning if you take the medicines regularly, you can definitely control the replication of virus, and you can have a pretty normal, healthy life. But what is important for all of us to remember is that taking HIV medicines, they do not prevent transmission of other sexually transmitted diseases. So it is important, I guess, these are also some of the frequently asked questions that I get from people, that if you're taking ART medicine, so there are some other sexually transmitted diseases like syphilis, gonorrhea. So there are some other infections. So if you're taking HIV medicines, it does not mean that the other sexually transmitted diseases would get prevented. So what is important is, even if you're taking HIV medicines, it's important to keep wearing condoms and take all other precautions. So this is a beautiful picture of some of our patients. You can see before ART how they were, and after the medicine. Look at the impact of ART. Look at the happy faces. So that's the beauty of the medicines. Okay, so when to start ART? Anybody who is infected, irrespective of whatever your count is, whatever your age is, whatever population groups you belong to, one should start ART or the medicine the moment you get infected. So as early as possible, that's the answer. And there is something which is very important, when you're starting the patients on ART, what is important is that you have to inform the person that it's a lifelong medicine, and HIV is not curable, meaning the person has to take ART for the whole lifelong period. And also something important is the prescribed dosage and the timing is very important. It should be taken every day on the scheduled time. And also when you actually take the ART, the person or the medical person would also tell you what is the follow-up. Follow-up meaning some of the investigations that you have to get it done. And also we check the viral load every 6 months to start with. So if you remember, I talked about viral load. So checking viral load is important, because that's how you see whether the person is actually having effective treatment. So that is the indicator for us to see if the treatment is working. So viral load and CD4 count is something that we keep on checking. Some of the essential investigations which are there, so I won't go into the details of this, but important to remember some of the investigations that we do before starting the person on ART, because we want to make sure that the person would remain healthy, because there are some interactions possible with some of the other diseases. ART preparedness is very important, and this is where I would like to comment on that. It is not a duty of only the medical professionals. It is important for for the person who is infected, the family, the friends, peer, and all of the people around. Give the protective environment, give the good environment, if at all the person has disclosed, because sometimes you won't know it. But what is important is we have to reduce the stigma and discrimination, because what we come across in the medical facilities a huge stigma and discrimination, and that is very important from all of us to practice something, so that we can ultimately reduce the stigma and discrimination. Because once the person is infected, the person is having a disease. For a medical professional like me, let's say, I do not discriminate. For me, any person who's having the disease, I have to treat it. Similarly, if the society can also accept what has happened is happened, the person is having the infection, now we have to do whatever is possible, so that the person can have a healthy, normal life. And how do you know your ART is working? I think I had answered that. Your CD4 count you can check, and then if your ART is working, your viral load would be very low. Daily taking ART daily is very, very, very important, because if you miss the dosage, the virus would become resistant, and also you get some other infections which are going to be very tough for you to treat. So this is something. Now, when we talked about the ART medicines, I was talking about the antiretroviral therapy. I would like you to look at this drug and keep it, or let's say try to remember this if possible. Or DTG is something which you can remember. DTG is a new drug. We call it almost like a magical or wonder drug. It's a beautiful drug in terms of the way it works. So it reduces the virus much faster than the regimens which were available before. It has got very fewer side effects, and it can be given to all the populations, including the pregnant women. Important to remember that almost all the regimens or all the drugs which are given to somebody who's infected is according to the age and weight, and what are the other diseases the person is having. So if diabetes or hypertension or something else, or kidney issues. So looking at that, the doctor decides what medicine and what dosage to be given to that particular person. And DTG-based regimens are the most likely, most acceptable regimen at this moment. But again, as I said, looking at the other diseases, so the doctor sometimes decide to switch, or let's say, or give something else. So if you ask somebody and the person is not having DTG, do not think that the person is not having the right drug. So sometimes you do not give DTG, and there are obvious medical reasons for that. Now, there is something about adherence. Adherence is important for all of us to remember that if somebody is taking drugs regularly, then, as I said before, the chances of having undetectable viral load is quite high, meaning it is possible to have undetectable viral load if you are adhering to the treatment that is being prescribed by your doctor. And why it is important, as I said before, if you're taking it regularly, your chances of developing complications are minimal, and also your chances of developing resistance is also minimal, and that's how you live a normal, healthy life. And some of the reasons that as a community that we have to understand, because ART is a lifelong medicine that you have to take. You have to travel all the way to the ART center. Sometimes you're working. Sometimes you have you're on holiday. You forgot. Think about that. For 3 or 4 or 5 days, if you have to take the medicine, and now you have to take the medicine for your whole life. So sometimes you don't want to disclose it. Sometimes you think that it cannot cure my situation. Sometimes there are some side effects which person gets, and because of which the person is would think I should not take the medicines anymore. Sometimes the family start asking questions. Sometimes any other myths or some issues that the person would have. But ultimately, what is important is that you have to take medicine, and it's important not just for the medical provider, for the community, for the people to come and support the person, so that the person can continue and treat it as a disease, not as a stigma or something which is bad. And then sometimes there are too many medicines, because the person can have other infections also. You go to the ART center, sometimes the line is quite long. Sometimes you have to travel a lot, especially in Northeast, because we have our projects in Northeast, and we all know, I've been to almost all the places, and we know how tough terrain sometimes bring to all these issues. So we're trying all the different kind of measures to reduce the travel time, and how and what all things we can do. But ultimately, overall, these are some of the reasons because of which sometimes the patient do not take the medicines. Some of the common side effects that we come across: diarrhea, feeling tired, headache, some nausea, vomiting. But what is important here is whatever you have, whatever side effects the person is having, report it to your medical officer and find out whether it is actually because of the medicine or there is something else. And because of these, we should not stop taking medicines. What is important is, all the normal things which, a person would do to have a normal, healthy life. Follow that, and that applies to HIV as well. Tips to improve, if you think that somebody I have to help to make sure that a person takes ART, because it's a lifelong medicine. So you can imagine it is tough, for anybody who's taking lifelong medicines, it's actually tough. So giving a reminder or supporting the system, there is something called treatment buddy, in the group also, suppose 5 or 6 people, those who are infected, they can help each other. There are a lot of ways, there are a lot of things that we try in the program, but what is important is ultimately the person should take the medicine. Now, what happens once you're done, even after that, you check for side effects, you make sure that you're taking medicines regularly. And whenever the person is asked for the follow-up investigations, you go and check your viral load, because once the viral load is almost negligible, that is when your CD4 count is fine and you get, a healthy life. But if it's the vice versa, as I said before, your immunity is bad and then you get all the infections, other infections other than HIV. So whenever I say infection, or when I'm talking about opportunistic infections, what I'm saying is, other than HIV, you get some infections because of which the person gets sick. So what is U is equal to U? U is equal to U, you must have seen in a lot of posters here and there, I'm sure, but what it stands for is U is equal to U is undetectable, is untransmittable, meaning there are a lot of studies which are talking about that if you're taking ART regularly, and if your viral load is undetectable, then there are very unlikely chances that you can actually sexually transmit the HIV virus to others. Keep in mind, I'm talking about the sexual transmission route here. All other routes, still there is a chance, but U is equal to U is important as a measure, because this also gives a lot of confidence to the person that if I take my medicines regularly, my viral load is going to be undetectable, and there are likely chances that I will get all the complications. So this is very important for us to know. Viral load I talked about. You check the viral load to see whether your ART is working or not. And when you do it, so for this, I won't go into the details of talking about when do we do it, but important thing is when somebody is infected, according to the medical person, whatever is the required frequency, you check your viral load. So this is important now, prevention of parent to child transmission. So as I talked about it before also, the transmission can happen from mother to baby. Now, it can occur during pregnancy, it can occur during labor and delivery, and that is the time when your maximum chances of transmission is happening. And also it can happen in breastfeeding. But what is very important is there are a lot of measures. So when somebody is pregnant, we call it like, the person should be on ART from starting. If somebody during pregnancy, you find out that you're having HIV, you can still start the person on ART medicine as soon as possible. And if you're taking ART, it is and also there is something called as prophylaxis to the baby. So we provide some prophylaxis to baby. So all this, and also at the same time, taking all the measures to avoid as much as possible chances of transmission during delivery. So, overall, altogether, if we practice that, the chances of transmission for parent to child is almost negligible. So that's very important to remember if you follow all the principles, and that we regularly do in the labor room, before the labor room and after the labor room. So as I said before, start the ART immediately as soon as possible. It is important to for a pregnant woman, if not on somebody who got or let's say who not that the person got infected, but somebody who was diagnosed during the pregnancy. So whatever is the situation, we have to make sure that we start the person on ART as soon as possible. It is going to be the biggest important preventive measure. And all other routine stuff, nutrition, care of nipples and breast, care of antenatal counseling and counsel for hospital delivery and all those things which are routine stuff. Again, for follow-up of a baby, what we do is we give all the prophylaxis which is possible. We immunize the child as per the recommended schedules. And if we do all these things, if we follow, the baby would be healthy. But what is important is the baby should not get the infection at the first place. So for that, we have to do all the precautionary measures before it, and diagnose the disease as early as possible. So now, I think last bit of slides. So common opportunistic infections is what I said. Somebody who's having HIV or AIDS, if the immune system is down, you get certain infections, and because of which you get all the problems. So tuberculosis is the most common opportunistic infection the person can have. Then hepatitis. There are some pneumonias, bacterial pneumonias, some fungal pneumonias, some viral pneumonias, some fungal infections. So all these infections ultimately would give you the issues. And if you develop any of the signs and symptoms, anything for that matter, if somebody is having HIV, and if you develop high-grade fever, you don't have to sit at home. You go to the RT center, tell that, and the medical officer there would try to find out what is troubling you. And if you get the opportunistic infection, you treat that, and you're still going to find. But what is important is if you take ART medicines regularly, your chances of developing opportunistic infections becomes very low. That's important to remember and follow. So priorities for somebody not should not get TB. Whenever there is a symptom or anything, you always try to make sure that you go to the medical officer or you go to the ART center and you talk about your symptoms, what's happening. Screening is important for TB for HIV patients, and which is a routine thing. Somebody who's having HIV, when you go to the RT center, we always do screen for tuberculosis. So common symptoms, as we know, for TB, cough, weight loss, blood stained sputum, night sweats, or anything of that. Anybody who's getting these symptoms, irrespective of even if you're not having HIV, you would have similar kind of symptoms if you're having TB. So any of this happens, rush to your medical officer and get yourself investigated. And there is also something newer advances. Let's say what we have is because the chances of developing tuberculosis in HIV patients is quite high. So what we do is, even if you're not having TB, we give preventive therapy. So we call it prophylaxis. We give it for 6 months. There is a drug called isoniazid that we do to make sure that the person do not develop TB infection. So that is something which we do for all the PLHIV patients. And also at the same time, along with this, we also give some other preventive therapies to PLHIV, which is called as cotrimoxazole preventive therapy, which is again for some of the infections like pneumonia, some toxoplasma. So there are some infections which we can prevent developing in PLHIV by providing those preventive therapies. So those are the routine things which are available in the program. And HIV, and also there is hepatitis coming very strongly, and HIV and hepatitis together, it's a bad combination. But what is important is you can have, because the route of transmissions are almost similar. You can develop hepatitis B and C if the person is having hepatitis or HIV at the same time, and then you get the infection from that person. Similar kind of risk factors as we saw in HIV, unsafe injections and procedures, unsafe sex, mother-to-child transmission, and sharing needles. So all these can also give you hepatitis. So important thing is, if you follow universal precautions, hopefully you can avoid all the infections which follow the common route. And then whoever is having hepatitis B or C, when you're there in the ERT center for HIV patients, we usually screen for hepatitis, and then somebody who's having active infection, we treat. And also at the same time, it is important to follow, again, as I repeatedly said, follow the universal precautions, because that is not going to only give you protection for HIV, but also for other diseases as well. Treatment for HIV and hepatitis, again, it is available in the public health programs. So you go to the RT center if you're having HIV infection and you get tested for hepatitis and you found positive, then the HIV program would link you with the hepatitis treatment program, and their hepatitis C would be and B would be treated. And there are good medicines available for both the hepatitis B and C. And hepatitis B also, there are some vaccinations available. So, what I'm all saying is there are a lot of preventive measures available, but what is important is follow the universal precautions so that one do not develop the disease. And in the end, I think last one or two slides on HIV and COVID-19. You all must have seen the COVID virus. But what is important is preventing COVID-19. What is happening? I guess you all must have seen these kind of presentations thousands of times. But what I'm trying to take you to is initially because this is a HIV topic. Initially, there were a lot of myths, or let's say a lot of confusion whether somebody who's having HIV should be given COVID vaccines or not. So in short, the priority was for for different groups, and PLHIV was one of those. So COVID-19 vaccines, yes, it should be given to PLHIV because their immune system is weak and they should be protected. So vaccination is the effective way to provide protection for severity of disease. So that's important. Vaccination should be given for all, including PLHIV. I'm not going to get into the details of how immunity works because I'm looking at the time, and I don't think, because this is going to be a totally different topic. But what I'm going to do is I'm going to give you a very quick snapshot of. So if you look at this, for any disease, what happens is no infection. In the end, you have death, and in between you have mild, moderate, severe. So it applies to all the infections. So, but this per se here, I'm talking about COVID-19. So important thing for us to remember is most of the things are here: no infection, mild and moderate. Very small percentage had severe disease and death. And the vaccines are giving you a lot of protection so that ultimately you do not fall into this spectrum, or the right side. What is happening is death and severity. So vaccines help you so that you do not develop the severe pathogenicity. So that's important for us to remember. All the vaccines are safe. Vaccination in PLHIV is important. People should be vaccinated. It is important to keep up with your CD4 cells count. So how do you do that? If you're taking effective ART, your CD4 counts would be good, and you are as good as any other person, and vaccination should be done. The only thing is, if your immunity is weak, sometimes the immune response is not that great. And that is the only difference. Otherwise, COVID-19, the vaccination is important for PLHIV. There is no other specific recommendation. It's just that, as I said before, sometimes you get reduced immune response. Otherwise, vaccines are well indicated for PLHIV growth. And any type of vaccine, all the vaccines are safe, can be given to PLHIV. No, there is no interaction between ART medication and COVID vaccine. So there's no pharmacological interaction. So it can be very safely given. There are some claims on social media, but there's no scientific evidence around it. So it is perfectly safe. And there's no special advice required for PLHIV. There is frequency of side effects. If somebody who is not having HIV, you can also develop some fever or tenderness at the site of injection or vaccination, and the similar kind of thing you would have in PLHIV also. Otherwise, there's no difference and everything is fine. One can go for vaccination, and that would be all. And I'm sorry because I think I had to rush somewhat in between because it's almost 1 hour now.
Sir,
So,
a few questions are there in the chat box. Could you please answer?
Yeah, for sure. That's what I was saying. So, how do we go about it? So, shall I read the questions or?
Sir, in the chat
Rajendra?
box, actually, few questions are there.
Okay, so I joined the session. What are the best preventive measures available in India? Who should use it? It is only for high-risk population. What are the side effects? Are the preventive measures one-time use? Must be taken continuously. Oops, it's not a one question. Huh? So, okay. So, see, if you remember the slide which I showed, the vaginal sex or anal sex or mother-to-child prevention, mother-to-child transmission, then sharing needles and syringes, and then we talk about blood products. So all these are different routes of transmission. So wherever, depending on the person's chances of exposure is, and accordingly the person should take all the preventive measures. So what do I mean by that? So there are some high risk populations. There are some commercial sex workers. There are men having sex with men, or any other high risk groups. So they should always take all the precautions, because we know that preventive measures, if you not take, we will get the infection. Similarly, if you're a medical person, if you're dealing with needle stick injuries, you will try to have all the precautions given in the medical profile, so you do not get the needle stick and get the infection. And suppose prevent, mother to child. If you're pregnant, get yourself tested, find out as early as possible, get the medicines, and there are chances that you will not be transmitting the infection to the baby. And all these preventive measures are available in the country. So there is something called as ICTC, which is Integrated Counseling and Testing Center. So in all the districts in India, there are somewhere around many thousands of ICTCs. So depending on which district you belong to, you can go to that ICTC center. Suppose if you think that you want yourself to be tested for HIV, you're having some doubt, or you had some exposure, and you want to find out whether you're infected or not, you can walk into the ICTC center, you can get yourself tested, and there itself you will get all the preventive measures list. You will get all the information, and most of the things are readily available. I mean, rest. So most of the things are like you avoid doing it, and some of the things are like condoms, which are readily available everywhere. There is something which is preventive measure. If since somebody asked, there is something called PrEP, which is called as pre-exposure prophylaxis. Pre-exposure prophylaxis is that if you're belonging to a particular high risk group and you want to take the medicine, so that the chances of you getting the infection would reduce. But as of now, PrEP is not there in the national program. It is sometimes available with the private practitioners, not all. So that is one additional thing which should come to India in coming years. And there is something called as post-exposure prophylaxis. That is also a preventive measure. Post-exposure prophylaxis is you got the exposure, you have a doubt, so you go to the medical person, and then talk about it. And within 72 hours of that exposure, you can actually take the medicine. So sometimes when you are having the or you had the exposure, the test which gives you the result would take some time sometimes. So and sometimes it won't even tell you whether you are infected, because it takes some time. So what we usually do is, looking at the exposure and the source information, we give post-exposure prophylaxis. Then again, that is also for medical professionals to decide. So whenever there is an exposure where you think that probably you might be exposed, it is my advice is go to the medical professional and talk about PEP. If you the idea is, do whatever is possible to reduce the chances of you getting the infection. But again, for any reason, if you are thinking that you got the exposure, then you go for post-exposure prophylaxis. There are very minimal side effects of preventive measures. So because condom and all the abstinence and all the things that you have to do, there is hardly any side effect. PrEP, sometimes because it's a medicine, sometimes you get some of the minor side effects. With PEP, which is post-exposure prophylaxis, again, you can get some of these side effects, but what is important is reducing the viral load in the body is important because it's a lifelong medicine. So whenever there is a doubt, go to the medical professional and talk about it because it's important you get the right answer rather than getting the some answer from some of the social media groups because it's a very specialized subject, and I would recommend or I would suggest that whenever there are some of these doubts, always reach out to a medical personnel so that the person can answer. Thank you. I hope I answered.
Sir, do HIV symptoms different in men and women? And how long does it take for the symptom to appear?
How long does the symptom take? So, if you remember my slide that I was showing in stage 1, stage 2, and all those things, right?
Sir,
For
like,
some people, it's okay. It's okay. I can explain. So, for some people,
like,
it's
is it
some.
different? Yeah. Actually, my response is it different in men and women? Like, I'm asking about the symptoms. Do
Is
HIV
it different
symptoms
in?
different
Sorry.
men and women?
Men and women. Oh, sorry. I
Yeah,
could not
yeah.
get the question. No. There's no difference. It's see, the difference is not because of whether you're a male or female. The difference is, or the progression of disease totally depends on. Suppose I got the infection. I had the exposure, but what I'm doing is I'm not talking about it for let's say 5 years, irrespective of whether I'm a male or female. And then your body is fighting, right? And in the end, what happens is all of a sudden, because now you're very sick, and that is when you decide to go to the medical personnel. And that becomes a problem because you're already in the late stage. And also at the same time, the person can have, let's say, diabetes, the person can have hypertension, the person can have hepatitis, the person can have any other infection. So depending on what other infections you're having, accordingly, you would have your signs and symptoms, not decided by your sex.
Okay, sir. So, and one more thing, what are the necessary, what are the necessary things we should take care in parlor and hospital to prevent from HIV and AIDS? Or
In what hospital? Sorry.
like, I'm saying, what are the necessary things we should take care in parlor and hospital to prevent
Okay,
from
parlors
HIV?
and hospital. Okay.
Yeah.
See, in simpler terms, the virus is in the body. It's flowing, let's say, in bloodstream. So any substance where there are chances of having the blood contamination, your risk of getting the infection becomes high. That is the maximum chances. So suppose you're there in the parlor and you're we all go for different procedures, and what we do is like sometimes the blades that people are using in the parlors, they do not change it, they do not sterilize it. So important is disposable these blades should be used, and you can ask for it. What I have done is, I mean, this is my personal choice. For us, I guess for 5 6 years, whenever I go for a haircut, I do not ask for the person to use blades. This is my personal choice. But again, if you're using a fresh, if you're asking the person to at least let the person open the blade in front of you, so that you know that it is freshly taken out from that. These are very basic things, and I don't think you need a doctor for that. I mean, it's a very basic common sense that anything which is sterilized is good. But also in the parlors, you would also imagine that not all the products are going to be sterilized. But again, uh, for for the materials or the things which are you are only touching your skin, not having the chances of contamination with blood, there is hardly any chance of getting HIV or other infections. but you can get something else. So, sometimes the basic concept is sterilization is important. It should be done. But if it is not contaminated by blood or any other products, your chances of getting HIV is quite minimal. So
Okay, thank you, sir.
sterilization, use the disposable things as much as possible. When you go to the hospital, you make sure that, see, usually in all the big and decent settings, there is hardly any chance that the person would use, or let's say the nurse there would use the same needle which to the other person. No, so they would discard the needle and then use the fresh needle for you. Uh, if there is any chance that you find that the same needle or the used one is being given to you, so you can definitely stop that. You have all the rights. So if you should avoid, you should definitely avoid that. And then second very important thing is, when you're receiving blood products, you are in emergency, you need blood, that's fine. But it's also important that the person can actually ask for it. You can ask for it whether this blood product or whatever I'm getting is free of HIV, free of hepatitis. So usually it is a duty of the hospital and also the medical professional to inform you. So these are the few basic things which you can definitely ask and keep in mind.
Sorry, in chat box, one of our sister has asked, can exchange cellular can cause HIV?
No. So this is, see, the problem here is whenever there is a chance of getting blood contamination, that is when the risk of HIV increases. So just to explain in a different way, as I said before, the chances of infection in anal sex is there. That is because sometimes the chances of contamination of, or let's say some mucosal rupture or anything for that matter. So whenever there is a chance of any mucosal rupture, whenever there is a chance of contamination of saliva from blood, let's say there's a cut and it got mixed with saliva. So yes, at that time there is a chance of getting the infection. So for any of that exposure, if there is a chance, or if there is the secretion or the product which is tinged, I mean blood tinged, or there is a blood mixed in that, then the chances of infection are there. Otherwise, plain saliva don't give you.
Oh, okay, sir. So anyone if still have any doubt, then can please ask. I think
Yeah, you can unmute yourself or whatever is comfortable.
So, sir, thank you so much for giving a precious time for today's session. So I think we will
My
end
pleasure.
here. So thank you, everyone. Again, thank you so much, sir.
Thank you.